Hello, this is Dr. Raj Chovatiya, and I'm Assistant Professor of Dermatology and Director for the Center of Eczema and Itch at the Northwestern University Feinberg School of Medicine. Now, while the efficacy, rapidity, and durability of JAK inhibitors as treatment for atopic dermatitis is pretty clear, many specific questions from patients center around potential adverse events highlighted in the prescribing information, i.e., the black box warning. These include mortality, infections, malignancy, major adverse cardiovascular events, and venous thromboembolism, to name a few. Now, black box warnings are an important mechanism used to highlight certain serious risks that may be associated with a particular drug or treatment class. While these adverse events are generally rare overall and are associated only with certain risk factors, they're still important to discuss right alongside efficacy, safety, and patient preference, which can include feasibility, cost, route of delivery, whenever it comes to helping an individual with atopic dermatitis select the most appropriate therapy. The main questions that come up in patient discussions in my clinic are usually some form of, are these risks real? And how does this relate to my situation? Again, like most treatment-related discussions, there really is no right or wrong answer, and it's highly dependent on someone's disease severity, comorbidities, previous treatment, to name a few. A number of these warnings have been broadly applied to the JAK inhibitors as a class based on data from long-term randomized post-marketing study assessing the safety of another JAK inhibitor, tofacitinib, versus tumor necrosis factor alpha inhibitors in patients with rheumatoid arthritis. In data we have so far with atopic dermatitis, most of these adverse events appear to be quite uncommon in this specific population treated with JAK inhibitors. Though, as is often the case in clinical trials, some events fitting into these categories were still observed in rare instances, though usually without clear relation to the medication itself. Thus, while JAK inhibitors appear to be highly efficacious with favorable safety in atopic dermatitis patients, more data and more time is needed to better understand this over the long run. So bottom line to me, this just means that I want to be as clear and transparent with patients as possible when it comes to talking about why a therapy may or may not be the best choice for them. I make it a point to leave extra time for questions and discussion so my patient will feel comfortable in the decision that we made together, rather than going home and realizing that none of their questions or concerns were actually addressed.